Dr. J here in the house with Evan Brand. We're going to do a live Q&A call. We may talk about some topics near and dear to us, what's trending. And then if you guys want to come in on the side and ask any questions, feel free. We are here to serve. Evan, what's cooking, man?
Hey, not too much is cooking, but I'm drinking some apple cider vinegar drink, good old Bragg's with some cinnamon. So that's good. This is a good like tummy tonic, and there's a small amount of sugar in here, but hey, I've got some stevia extract in here, some ACV, some little bit of apple juice. I could probably make this myself, but it's so convenient for $2 to go buy one of these and just have a nice little tonic.
I know, totally. Just the convenience aspect is really nice. I like the lime one. The lime one's really good too because it's only sweetened with stevia.
Oh, that one doesn't have sugar.
Yeah, that one's a good one.
Oh, yeah, I didn't know that
Love it.
existed. Well,
I
I
know,
did an
man. Now you
interview.
know.
I did an interview this morning with for my summit, and it was all about SIFO. So I figured maybe we could chat about that, like small intestinal fungal overgrowth and what we're seeing. You know, SIBO is like such a hot topic, but people aren't really talking about SIFO. And you and I are seeing so many people every week. I'd say it's what 90% of the people have a yeast overgrowth.
Yeah, I think when we look at yeast, for instance, we do a typical SIBO test, which looks at methane and hydrogen gases, which are, you give a sugar solution via lactulose to the person, and that sugar is undigestible to the body except certain bacteria that are dysbiotic. And when those bacteria eat that lactulose solution, they spit off methane or hydrogen gases, depending on what bacteria they are. And that hydrogen can either disrupt and cause diarrhea or increase motility, or it can cause decreased motility via methane. So, of course, we see it with various gases indirectly. We don't know the exact bacteria, but we know that those gases are there because the exhaust created by it. It's kind of like you don't know a car's in the garage if it's not there, but if you smell the exhaust that it left a minute ago, you can kind of tell, right? So it's kind of like that. And of course, people can have, or patients can have, symptoms in their gut via fungal overgrowth, and symptoms can overlap pretty well. So you may have a fungal overgrowth or something else happening, and you may think it's a small intestinal bacterial overgrowth. You may come back on the test with nothing in that area, but we may do other testing that shows a fungal overgrowth is present. So
Yep.
SIFO is definitely an issue.
Yeah. So let's go through symptoms a bit. What does somebody know if or expect if they have SIBO or SIFO? It's going to be the bloating, could be fatigue, could be anxiety, could be brain fog, could be food cravings, sugar cravings could be possible. I mentioned the mood issues like anxiety because most people don't think about it, gut being a cause of anxiety, but it is. And when I had gut issues, I had anxiety, I lost weight, I had brain fog, I had fatigue. It was all because of my infections.
100%. And a lot of people who have gut issues, right, they're going to have a lot of mood issues or energy issues too. It's very rare that someone only has gut issues. Like they could have diarrhea, bloating, or gas, or indigestion, or GERD, or acid reflux, or gastroparesis, where their food just sits in your tummy for a long time. But it's very possible that you could just have mood issues, brain fog. With fungus, it's common to have joint pain. It's common to have brain fog. It's even common to have anxiety too. The yeast kind of metabolic byproducts in the gut, when they're metabolized, they can spit off acid aldehyde. Acid aldehyde can then create a compound called cell-solidol. Cell-solidol can create apoptosis in the midbrain, where it can actually kill off some of the substantia nigra cells that produce dopamine. So, of course, chronic yeast issues, severe yeast issues, but could potentially create more neurological issues due to all the toxic byproducts.
That's a trip. Now, I know Saccharomyces boulardii, we talk about it, we use it. I've heard that Saccharomyces could do two things. Maybe you could elaborate on this a bit. I've heard that Saccharomyces is one going to help to crowd out the yeast, but it can also kill the toxins that Candida is producing. Can you speak on that? Do you know what I'm talking about?
Yeah, I mean, yeast, Candida can also produce, or as a byproduct, they're going to produce mycotoxins, right? And these toxic byproducts can disrupt digestion. They're also, acid aldehydes, a stressor that's produced by the Candida that I mentioned earlier. And Candida is one type of yeast. You could have, the Rhodotorula species, the typical Candida albicans. That's the Candida that everyone refers to. You have the Geotrichum. You have these species as well. So, of course, these things can cause similar symptoms as SIBO, and they can create toxic load because of how it disrupts toxicity, how it disrupts digestion. You need nutrients to run our detox pathways. It can create these mycotoxins, which then have to be processed by our detoxification system as well. And of course, it can stress out the immune system because 80% of our immune cells live in our gut, and it can create more permeability with the gut, i.e. leaky gut, which then gets the immune system fired up, which is kind of like leaving the faucet on in your guest bedroom that you never go into, and then your water bill sky high that month.
Yep, well said. So let's talk about treatment a bit. I mean, some of the options that we use, conventional docs. Maybe let's chat about that first. I mean, we always go straight to the functional medicine piece and assume that people understand that, but I don't think many people understand what and how poorly conventional medicine treats Candida and bacterial overgrowth type issues.
Well, most of the time, conventional medicine is going to, typically laugh at your face when you talk about Candida. And unless you have, number one, you have some type of skin-oriented rash like a tinea versicolor or some kind of seborrheic dermatitis that's apparent on the skin, right? It's like it's there. You can see it. It's apparent, and they'll recommend some kind of antifungal cream, and they won't ever look deeper in the gut, which tends to be the root of where it comes from. Or there's like a vaginal yeast infection, or there's some kind of thrush where there's a white coating around your mouth or tongue. So unless you have those 2 or 3 things, for the most part, it's not going to be picked up. And Candida, like we mentioned, can create a whole host of issues: fatigue, mood. It can create things that are non-digestive. It can create things that are digestive that I already mentioned. And if you go into your conventional medical doctor, it's typically not going to be picked up. We can even see it via antibodies too. So sometimes people will do a stool test, but we'll actually see the Candida via the antibodies. It's hard to pick up. So we'll always use clinical symptoms too. Oh, the other one was a fungal toenail, like a yellow kind of thick and discolored toenail. That'd be the 4th one.
What about on the fingers too? I've seen people with like a yellow nail where it's like falling off.
It's the same thing, right? Toenail and fingernail is the same kind of thing.
Yeah. Okay.
That thickened type of fungal thing. So we on the nails, on the skin, typically on the mouth, and then typically vaginal. And let's say number 5 would be kind of like a seborrheic dermatitis, or like a cradle cap, or like a dandruff. It's kind of in that same fungal category. So 5 big ones: hair, mouth, vaginal, skin, nails.
Got it.
Toe or finger.
Yeah. So let's talk about UTIs for a bit. Now, when you hear about a urinary tract infection, a lot of times this is affecting women. Is that bacteria plus Candida at the same time?
Typically, it depends. Typically, it's going to be bacteria. The number one way you can figure it out is typically bacterial vaginosis will have kind of a fishy odor to it. So it's going to smell a little bit fishy, and women know it's like, okay, it's apparent something's going on down there. Yeast infection typically is not going to smell like that. It may smell a little bit yeasty, almost like a brewery kind of smell, but it's not going to have that kind of fishy odor smell. That's the number one. Both are going to have discharge. Both are going to have discharge, typically like, a kind of a cottage cheesy kind of film. We're getting pretty graphic here, but hey, this is what we do all week long. So of course, that's the big way. And then typically your UTI is going to affect primarily the urinary tract, right? Bacterial vaginosis involves more the Gardnerella bacteria. The UTI is more going to be the E. coli bacteria. And then of course, yeast is going to be more like your Candida albicans kind of thing. So of course, like, if it's a UTI, you tend to feel it tends to hurt more when you pee, a little bit, maybe pain or stinginess when you pee. Bacterial vaginosis, probably not as much, maybe just itchy. And I think the big, dividing factor would probably be the odor as how you would know.
Okay.
And of course, you can get a culture. You can get a culture, right? If you go see your doc, they may do a culture. But in terms of treatment for bacterial vaginosis, we may do kind of an herbal formula mixed with apple cider vinegar. And we may get like a douche applicator and flush that area out for a week or 2. And then we may throw some probiotics in internally via the mouth and intravaginally to help shift the pH. Typically, getting a more acidic pH makes it harder for that bacteria to grow. Obviously, cutting out the refined sugar and the junk of your food too. With yeast, similar thing. We have some boric acid or suppositories that we'll use as well to help. We'll also get the probiotics going and cut out the refined sugar. And then for UTI stuff, we'll typically use some silver. We can use some D-mannose powder. We can use uva ursi herbs. We can do apple cider vinegar, lemon juice. These are all really good things that we can do to help acidify the pH, acidify the urinary tract. Also, we can do cranberry juice extract, non-sweetened, organic, We can also do some organic cranberry pills as well. That has a big shift on the pH in the urinary tract, which then starts to starve them out because they tend to not live as well in that nice acidic environment. They tend to grow more in an alkaline environment.
So let me ask you this. Could you successfully treat a UTI just by hitting the gut?
You could, again, like some of the things we'd want to do is we want to make sure that some of those herbal metabolites make their way out the vaginal, I mean, typically UTI, it's going to go out, right? It's going to go out. And so the urinary tract will be hit. The question is, will the vaginal area be hit? Obviously, if we're peeing it out, it's not going to be hit. It's close in that area, but more than likely it's not going to hit it. That's where you'd need some kind of an herbal douche formula to topically get in there. Same thing with the yeast. So yeast, you kind of want to topically get in there with a suppository. BV, get in there with a flushing type of herbal mechanism, and just make sure you're not pregnant, right? Because there could be some abortifactant mechanism there if it's getting too close, up the vaginal canal. And then number 3 is the UTI that we could do internally, and we could flush out that way.
So could you go, are there like professional grade herbal douche blends, or is that something you've got to piece together yourself? Like, does a store-bought version exist?
Yeah, I have one that I use that works really well. It's called Herbal Douche Formula. And then we just use an applicator and we mix it with some apple cider vinegar, like the instructions say, and we flush one to 2 times a day. Gotta shift the diet. Typically should do a really good probiotic intravaginally as well to kind of help shift the pH and shift the microbiome there.
Is there a brand for that?
Yeah, I like one by Wise Woman Herbals that I use for the herbal douche formula. And then the probiotics we'll typically do, my ProbioFlora, or we'll do a woman's formula, but typically the ProbioFlora is enough as well.
Cool.
Okay. The ProbioFlora too is the phage in there really helps kill E. coli too. So if there's any UTI stuff going on too, that could also help with that too.
I'm going to bookmark that. That's really, really cool. So in this, I feel like the douche is something good where if you've got like a resistant infection or something that just keeps coming back, sounds like that would be a good thing to add in.
Yeah. And then typically though, even if let's say we do topically hit that area, we still want to make sure we systemically treat things too. Like we would topically hit something because we want a faster result. Right. Like let's say there was a fungal nail, right? It may be really hard to get rid of that fungus on that nail if we just hit it to the gut. So we kind of want to hit it from both ends. So we kind of want to put that critter between a rock and a hard place, make it so it has nowhere to go.
So do you add apple cider vinegar to this? I know it comes with it.
Yeah, we'd add it to it.
Okay.
I think it says like add 6 ounces of apple cider vinegar or something if you read the instructions on how to mix it.
Because like in the ingredients, it says it's in a base of ACV. So I was just curious. And
can you read the instructions?
Yeah, it says add 1 tablespoon of concentrate per 6 ounces of warm water.
Per warm water.
Yeah.
Got it. Yeah. So then it's the warm water then. So the apple cider vinegar is already in it. So we would just add that to the warm water.
That's really cool, man. I learn something new every day.
That's it.
Wow. Well, thanks. Well, let's look at some questions and see what we've got here digestively. Evie asked you a question. Dr. J, I've been taking your Digestive Supreme and HCl. They're helping a lot. Thanks. Is it okay to take for a long time, or should I stop after some time?
So typically, if there's an infection, we want to get rid of the infection and then we can taper down. And then the rest is going to be based upon you. So if you're under a lot of stress during the day, then we may want to take it during stressful periods. If you're eating food that's maybe a little bit questionable, we want to save it for that. So get rid of the infections, get rid of the internal stress that's causing the issue. As long as your diet's on track and the stressful environment's kind of under control and you're not hydrating so much during the meal, then I think it'd be okay to reduce the consistency on that for sure.
And I'll throw my 2 cents in. Yes. I cycle on and off enzymes personally. So I just got my stool test back. I showed up with some gut bacteria, showed up with a cyclospore parasite. So needless to say, I'm back on enzymes while I'm clearing out these infections, because the last thing you want is undigested food particles feeding the bugs. Like Justin mentioned, if you've got an infection, something that like H. pylori could be suppressing stomach acid, that's undigested food that's going straight to the bad guys.
Yeah. And I noticed myself, I was just having looser stools for the last few weeks, only after coffee. And it was just typically just a different consistency. So I just I still hit my GI Clear 4 and Para 1 up. And I noticed that it did start to solidify again, even after coffee. So I'm going to be doing a GI map test at the end of this month and see where I'm at. Well,
let's go through your results when they come. That'd be a fun show.
Yeah, I'm excited. And then also, I saw your test last night. I saw the increased steatocrit on yours and
I
the
know.
increased beta glucuronidase. So definitely hitting it with the antimicrobial herbal stuff, maybe adding in some extra bile salts or lipase in there too would also help.
Yeah, I appreciate it. I'm gonna do that, and then also I'm gonna add in some milk thistle too. Try to get that glucuronidase down. I
Yeah.
know probiotics can do it, but I think I'd rather probably do both.
Well, yeah, I mean, glucuronidase is going to be, if you kill the bacteria, that'll go down too,
Okay,
right?
that's
You could
good.
just throw in some extra charcoal to help bind that up too.
Okay. Also, we'll have to chat, but where we're getting our Para One, there's also a binder that they've got, which is like a fulvic acid charcoal
Yeah.
mix.
I've seen that. I think that's good too. I find that, the charcoal is still really good as well. So you could do either
And for
one,
the
but I
price.
like the charcoal. Yeah.
And the charcoal's so cheap.
So that's the thing. The charcoal is just a little bit more cost effective. That's why I like it.
Yeah, you can't beat it. Okay,
And it's
cool.
still great. I mean, it's still, you can use it for alcohol. I had my Patriots played yesterday. My Tom Brady, dude, he's freaking awesome, man. He's the GOAT. And, he is just like the perfect, like, practitioner or spokesperson for natural medicine. I mean, what he does with his diet, I mean, he eats basically a paleo autoimmune template for the most part because he's trying to keep inflammation down.
Yeah.
And, he trains in a way to support pliability and muscle lengthening, which we'll have to, I'm trying to get his trainer on, man. I got to get him on and speak to him. I know we're going to work on that, but yeah, he's a perfect practitioner of all this stuff. But in regards to, where was I going? So we just talked about,
I think you were talking about.
oh yes, I'm sorry. So I had a nice glass of 2 of champagne yesterday.
Oh,
so I
okay.
hit up some activated charcoal and I hit up some sulfur amino acids and I feel phenomenal, no issues. And then of course I have a nice glass of mineral water in between drinks that prevents any, the antidiuretic hormone that's being reduced. So all the peeing that happens from alcohol prevents any of those minerals from being washed out. So that's my little tip there.
That's cool. Anybody listening, watching, add your comments. We're going to go through these. We'll try to answer as many that are on topic as we can. So add your comments now. So we'll go through it
Yes.
now.
And we'll hit the ones that are on topic as first. And then also give us a share, give us a like, give us a thumbs up. We appreciate it, guys. Help us grow so we can help more people like you. You're benefiting right now. Don't keep it all to you. Let it get out there. We appreciate it.
Absolutely. What's our timeline? How much time we got left for these questions?
We got 5 minutes. Let's roll through.
Okay. All right. So we've got one here from Jeff. He says that he's been taking the GI Clear 1, 2, and 5, 2 caps a week for H. pylori. Yesterday was his birthday. He's been so sick, nausea, headaches, panic attacks. How should I take the herbs on an empty tummy?
So number one, I'm imagining that because it was your birthday, you may have gone off the rings there, Jeff, maybe with some extra birthday type of surprises or things like that. So there could be that. Number one, if we're having some sensitivities, we need to come off the herbs for 3 to 5 days, get back to baseline, add in the ginger tea, and then ratchet up 1 capsule per day on each herbal product. If you hit the wall, meaning you start to have those nausea or negative symptoms, you back off. Get super stable before you go to the next. And of course, if you're having issues, take it with food because the food kind of prevents a buffer so those herbs aren't sitting up against an irritated gastric mucosa. Add in the ginger, and then we should probably throw in some activated charcoal in between breakfast and lunch away from food and lunch and dinner away from food. That will maximize absorption of any of the toxins. But dial in the dose. Don't be a hero and push it too high and too fast. Take it with food. Take a couple of days off and then add it back in.
Yep, good advice. Another question here, Dr. J. I've been following your advice, but not perfectly. I've had long-term constipation, GERD, gastritis, H. pylori, bloating, abdominal distension, cramping. How can I help myself? I'll answer this one.
Yes, you got it. Do it.
You've got to get tested. I know you said I've been following your advice, meaning you've probably been watching Dr. J's videos, maybe some of the stuff that we're doing together like this. But if you've not got the testing done, then you've got to do that. If you say H. pylori, if it's still there, you're going to have these symptoms. So you've got to get some functional medicine testing. You can reach out, get that done, and we've got to fix the bugs. You're never going to fix constipation if you've got bacterial overgrowth because those gases are going to change the intestinal motility time. Bloating, same thing. That could be yeast, fungus, bacteria, H. pylori. We know that's why you've got the GERD because that's suppressing your stomach acid. You're going to have heartburn because your body's not going to allow the undigested food to go down. So get tested, and then we can use herbs to fix this.
100%.
Let's keep going here. Got another question from Kitty. She's taking the beef protein powder, and it makes her constipated. Should she take HCl and pepsin, even though it's a powder?
I would say you could try it and see what happens. If it doesn't work, there could be something in it that you're allergic to. So I would try a collagen protein that's in a peptide form and see if that shifts or changes it, because that's going to be in a more broken down assimilated form. So try it. Try more enzymes in HCl and see what happens first, and then try just a really clean, like, my True Collagen. Try something in a collagen peptide form and see if that fixes it, and then let us know.
Good advice. Another question. Hi, Dr. J. I'd like to ask you how to detox from heavy metals, toxins, parasites, etc. naturally. We've done a ton of shows on this. We'll continue to probably hit this topic, but just search justinhealth.com or search the YouTube channel here for those titles, and you're going to find some stuff. But that could be an hours and hours and hours conversation.
Totally. Yep, absolutely.
Samuel, you want to read that one?
Yeah. Is it possible to overpopulate with good bacteria using probiotics? And if so, what steps do you take to balance? So number one, we can see it with patients that tend to have like digestive issues or SIBO. We see an excessive amount of D-lactate, which can be caused by throwing a whole bunch of lactobacillus in with a whole bunch of dysbiotic bacteria. So we can see that. So number one, make sure we're starting from a blank canvas, not a canvas full of messiness from the start. Number two, probiotics tend to be transient. They're not going to stay around longer than a month or so. So they are transient. So number one, a good steady dose of them is going to be fine. So, 2 to 4 capsules, I think, is a reasonable amount, like with my ProBioFlora. And I think, some couple sources of fermented foods that you want to throw in weekly, whether it's a lower sugar kombucha, fermented pickles, sauerkraut. Those are all good standard options that you can kind of add in. And I think as long as your digestive symptoms are under control and you're infection free, I would not worry about it. If you're having a lot of bloat or gas because of probiotics, we probably have to look a little deeper at see what's happening with the dysbiosis or other infections.
Yep. One more question right next to that. You want to hit that one too?
Top herbs for Candida overgrowth.
Yep.
Oil oregano, berberines, silver, not really an herb, but it's still something that we use. Clove, wild indigo, grapefruit seed extract. I would say those are a couple right there. Anything you want to add?
Yeah, I'd like to add
olive acid.
Yeah, olive leaf.
Olive leaf, yep.
The monolaurin, the lauric acid.
Monolaurin, lauric acid, yep.
I would also say, we've got so many formulas. I would just say to look at our GI formulas. Justin's got several custom formulas. I do as well. You could check our sites, justinhealth.com, evanbrand.com. We've got many, and these herbs in isolation can work pretty good, but we really like to focus on the synergistic effect of herbs together.
Yeah, like for instance, berberines and artemisia. If you look at Stephen Buhner's book, he talks about the synergistic effect that you have with those herbs together. So like 1 and 1 equals 10, not 2. So combining some of these herbs together work phenomenal.
Yeah. You want to hit Tammy's question?
Yeah. I get stomach pain when I take proteolytic enzymes. What does that mean? I had H. pylori and stomach ulcers twice in the past. So number one, I'd make sure you're not taking the enzymes on an empty stomach. I'd take them in the middle of a meal. Okay. Number two, I would just see that, if you didn't take the enzymes, would you also have stomach pain? Or is the enzymes the only variable factor? And if you have a lot of stomach ulcers and those kind of things, number one, we need to support and start adding some healing and soothing herbs, potentially lower the dose and make the food more liquid or pre-digested in kind of like a crock pot type of format. So the food's easier to process, nothing raw. Even if it's like raw broccoli or like raw paleo veggies, that may still be too much. So I would look at crock pot liquid form, healing, soothing herbs and amino acids, kind of what's in my GI Restore. Add every variable in one at a time. So that way, you get the foods dialed in, right? You get, the type of food and the cooking process dialed in. You add some soothing herbs. You do the enzymes. You start with a very low dose. You work it up. You isolate and you do each variable one at a time so you know what's going on.
Yep. And I would like to add, make sure that you're infection free. You said you had H. pylori and stomach ulcers twice in the past. Gastroenterology is very, very, very inaccurate. Some of their testing, you can have false negatives. We see it every week. So just get retested. Make sure you're free and clear. Make sure there's no other infections or that H. pylori plus virulence factors, which is something we test for. Make sure that that's not there.
And again, here's the deal too. If you're having issues potentially with food or enzymes, then you're sure as heck going to have issues with herbs to knock out the infection. So work on the first 3 R's first. Removing the bad foods, replacing enzymes and acids to the right dosage, taken the right way, healing, soothing nutrients, and adrenal support. So adrenals, ginger tea, amino acids, healing, soothing herbs, and then make the food really palatable so it's easier to process.
Great advice. Angel, do you recommend diatomaceous earth for Candida?
I think it's great to help with the killing and binding effect. It's good at worms. I use it to kill ants in my backyard when I see them. Diatomaceous earth has a high amount of silica in it, and it basically dehydrates the exoskeleton of the insects. So it's a great non-toxic thing. You can also swallow it too, so it can dehydrate the worms too and kill them.
That's neat. Question from Noreen. You two are awesome. Thank you, Noreen. Where do you guys practice? So Justin
Everywhere
lives
in the ether.
Yeah, everywhere. Justin lives in Texas. I live in Kentucky, but we are 100% via phone and Skype consults.
That's it.
Riley, how long should you take the GI Restore for with probiotics after a parasite killing protocol?
Typically a combination. Typically, if we're looking at it objectively, till caloprotectin goes down, which is an inflammatory protein that's produced by the gut when there's inflammation, and or till you're infection-free. So if we're infection-free, then we really want to see that caloprotectin go down. And ideally, that correlates with symptoms improving and the gut mucosa just becoming better and feeling better.
I would say generally, though, to give a number, I try to get people to run through about
2 to 4 months.
bottles.
Yep, I think 2 to 4 months on average. I know Riley's case in particular, he's had issues with H. pylori in the past. So there could be just some thinning gastric mucosa that's just more sensitive. And we just need to make sure that infection's crossed off our list and then start the timer, 2 to 4 months from when that infection's gone.
Okay.
Kind of thing.
That's good. That's good. Addie asked, do we recommend grapeseed extract for Candida? Yes, we use it in our formulas. It can help.
Absolutely.
Another question here, thoughts on prebiotic supplements? I think is our last question that we have time for. Do we need prebiotics if we have lots of vegetables in the diet?
I think you can throw in some resistant starch, either some unripened banana flour or a little bit of a cool potato flour. I think that's great. Throw it in a protein shake. We typically, and I think my ProBioFlora and maybe your probiotic, there's a little bit of inulin or chicory root, which can be helpful. But in general, some of that starchy carbohydrate, and it can start with a very small amount, can be helpful. And take a look at my videos on resistant starch for more info on that.
Oh, good. Glad you got a video there. Well, that's all we've got time for question-wise. I think we hit most of them, though, unless there were some off topic. But we hope this was helpful. Make sure you guys hit subscribe. If you're not subscribed to the channel, go ahead, hit subscribe right now because you'll get notified. Make sure you hit the bell, too, because we're back.
Everyone's like, hey, Dr. J, like, when are you going to be live? So we're going to try to let you know a day ahead of time. But if you hit the bell, it's going to pop up on your YouTube app on your computer or phone. And it's going to say, Dr. J and Evan are live. And then you're going to know. Generally
speaking, though, you guys should expect us here every Monday at anywhere between 11:30 and 12 Eastern.
Yeah. That's the general kind of gist. And I'll be online typically 9:30 to 10 CST, which is 10:30 to 11 EST on Fridays for our FAQ for you all. So, go ahead and stalk us here, subscribe, hit the bell, and we'll be back for more content very soon. If you have one last question here. Yeah. One last question. Can you overdo it with herbs? Yeah, you can, Charletto. So just make sure if you're people that are sensitive, they kind of already know it, right? Yeah. They have issues with vitamin C and issues with probiotics or issues with HCl. And it's like, these are patients like we got to take our kid gloves and put them on because we got to go. Everything has to be very slow and very gentle. And it's not that you're weaker or have, it's not anything. It's not a negative on you. It's just your system where it's at. So if we go a little bit slower, it helps. It's kind of like you want to take a cold shower, get in the shower, get it on warm, and then just inch the dial a little bit cold, to the cold direction. And then before you know it, in 3 to 5 minutes, you're in a cold shower, and it wasn't that difficult. So if we have to, we can go slow. Of course, working on ginger tea and soothing nutrients to get the gut lining, more tonifying, relaxing things, adrenal support, and then we can inch into the herbs as well. So for sure. Absolutely. Oh, I'm going to add last 2 cents because you mentioned the word adrenal. Yeah, if your adrenals are weak, your gut protocol is going to be much more heavy hitting on you. So if you're working with a practitioner, you guys are just looking at the gut, make sure you're asking questions about thyroid and adrenals and hormones because, Justin and I are utilizing a 3-body system approach, which is adrenals, gut, thyroid, detoxification, things like that. And if all these other pillars aren't there and you're just hitting one avenue really hard, you're going to crash out. So make sure those other pillars are involved. Otherwise, the
the progress will not be as well. And that could explain why you're not handling the herbs as much.
And it's human nature. Once people find out they have a critter in them, they're like, get rid of it. Oh my gosh, like this is awful. And I get it. It's a normal reaction, but we have to make sure the bigger picture is we don't want to get reinfected. The bigger picture is we don't want to feel worse either. So there's a sequence in which we have to do it. And it takes a little bit of trust, because the normal reaction is get rid of it now. Get rid of it yesterday, right?
Yeah, for sure.
Okay. Awesome. Well, great call. Slam that bell. Give us a share. We appreciate everyone watching, and I hope everyone's health takes one notch in the right direction today. Appreciate it.
Take care.
All. Bye, Evan.